The UK has hit a major milestone with more than 15 million people given their first dose of the coronavirus vaccine. In England, everyone in the top 4 priority groups has now been offered a first jab. That's a day ahead of the scheduled target. The Prime Minister praised a truly nationwide effort and said that everybody who'd contributed, from NHS staff to volunteers, should be incredibly proud. The success of the vaccination programme has led to a growing pressure for a clearer roadmap out of lockdown and a return to some kind of normality, including from some of Mr Johnson's own MPs. Here's our political correspondent, Jonathan Blake.
Lining up in Lancashire for the coronavirus vaccine, some of those getting their first jab today and taking the total number to be offered an injection to 15 million across the UK.
This country has achieved an extraordinary feat.
In a video posted online, the Prime Minister confirmed the government had met its target of offering the 4 most vulnerable groups in England their first jab by mid-February.
It has been a truly national, UK-wide effort. We've done it together. And I want to thank each and every person who has helped make it happen. You can be incredibly proud of the part you've played.
With vaccinations in full flow, the Prime Minister's promised a roadmap out of lockdown in England a week tomorrow, the 22nd of February. The government wants schools to open to all pupils on the 8th of March. Next, more outdoor recreation is likely to be allowed, followed by more shops being able to open, and finally, hospitality venues.
Hi, my name's Libby. I'll do your vaccination today.
But with the aim now to offer everyone over 50 their first jab by the end of April, some argue all legal restrictions should end by then.
It's completely tied to the rollout of the vaccination programme and the fact that you're then protecting the most vulnerable people from death and serious disease from COVID from the fantastically successful vaccination programme the NHS is undertaking.
And in the industries worst affected, there's an urgency to start trading soon.
We think we can open very safely for Easter weekend. We understand, as I said, that there would be social restrictions in place like there were in July, and we will absolutely administer those to the letter. And we will ensure that we've got a responsibility for our customers and our staff.
Some Conservative MPs are growing increasingly frustrated and want firm commitments from the Prime Minister about when restrictions will be lifted. But although Boris Johnson can't ignore the political pressure from his own party, the risks of opening things up too soon seem to be weighing more heavily. And for now, the watchword in government is caution until the impact of the vaccines becomes clear. Political opponents will be the first to accuse Boris Johnson of easing restrictions before coronavirus is contained.
This lockdown has to be the final lockdown, by the way. The strategic aim is to do everything we can now so we don't have to go back into a lockdown.
While seizing on the success of the vaccination programme so far, the Prime Minister acknowledged there was much more work to do. The return to normal is still some way off. Jonathan Blake, BBC News.
So, having reached the first major vaccination target, how does the rollout proceed from here, and who's next in line for the jab? Our science correspondent Rebecca Morelle reports.
From Margaret Keenan in December, the first person to be vaccinated, to less than 10 weeks later, 15 million people have had their first dose. So who will be vaccinated next and when?
The next stage starts with 65 to 69-year-olds. That's nearly 3 million people. And those with underlying health conditions, an estimated 7 million. Next up, it's 2 million 60 to 64-year-olds, then the 5 million 50 to 59-year-olds. That's a total of more than 17 million people who'll be offered vaccines by the end of April. Then for phase 2, another 21 million people. The rest of the adult population should be vaccinated by the autumn.
More than 1 million over 65s have already been sent letters this weekend, and some areas have even started delivering jabs.
It's an indication of the different demographics of different parts of the country. Obviously, certain populations will have much higher proportions of those people who are over 70 or who are housebound, and that will take longer. In my practice in North London, we are vaccinating already those people over 60 and 65.
People with some medical conditions are also being invited. These include chronic lung disease, Down syndrome, diabetes, some cancers and morbid obesity. So how will we know if vaccination is working? The best place to look is Israel, which has inoculated more of its population than anywhere else in the world. And hospitalisations of those who were vaccinated first, the over 60s, are falling much faster than other groups. So when could we see an impact in the UK?
In about a week's time, we may well see beginnings of an effect in hospitalisations, particularly in older people, relative to changes in younger people. It'll be cases, it's going to be a little bit less clear, I think, because vaccine doesn't necessarily stop mild cases.
In the coming weeks, could there be any problems? There will be some bumps in supply with Pfizer overhauling its factory in Belgium. New variants could also pose a problem, and booster shots might be needed to improve immunity. COVID levels in the UK are still high, but vaccination should soon make a difference, helping us map a path out of lockdown. Rebecca Morelle, BBC News.